Good morning, everyone, and welcome to the Caribbean launch of the 2020 Global AIDS Update. We are thrilled to be able to share with you Caribbean results as of the end of 2019. Let me begin by first recognizing our panelists. We have Dr. Joy St. John, who is the Executive Director of the Caribbean Public Health Agency, CARPHA. Dr. Rosmond Adams, who is the Director of the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP. Mrs. Kim Simplis Barrow, who is the Chair of the Spouses of the Caribbean Leaders Action Network, SCLAN. And Ms. Renatta Langlais, who is the Vice Chair of the Caribbean Regional Network of People Living with HIV. This year, the report, apart from providing the usual updates on data, includes a focus on COVID-19. What has its impact been on the AIDS response, and how do both disease responses move together to ensure that they are strong and successful? There's also a focus in this year's report on the status of women and girls. Just a bit of housekeeping before we proceed. There is a little chat icon that's next to the raise your hand icon on your screen. So at any point during the proceedings, if a question occurs to you, please do feel free to type it in. I will be reviewing the questions, and we'll have about 10 to 12 minutes where we'll get to squeeze as many of them in as possible, and the appropriate panelist will respond. Next issue, everybody will be muted, and we will just have the presenters unmute and switch their cameras on when they are ready to present. I'm going to hand over to Dr. James Guwani, who is the Director of the UNAIDS Caribbean Sub-Regional Office, to present the Caribbean results for 2019. Dr. Guwani, over to you.
Thank you very much, colleagues. I'll share update highlights from the current global report, which is entitled Seizing the Moment. We will share these slides if requested at some later date, so I will be quick on that. In 2016, UN member states agreed that ending the AIDS epidemic by 2030 required the quick expansion of HIV services for prevention, testing, and treatment. They committed to achieving 90-90-90 targets, which is 90% of people living with HIV aware of their status, 90% of diagnosed people on treatment, and 90% of those on treatment virally suppressed by the end of 2020. But the fast-track strategy includes other priorities, including ones related to gender, equality, social protection, community-led service delivery, and empowerment. At the time that we now have the science to end AIDS, our biggest barriers are prejudice and exclusion. There have been great successes on HIV responses, but progress is extremely uneven. We now know that the world will miss the 2020 targets. We must double down and act with greater urgency to reach those still left behind. First, let's look at the global picture. At the end of 2019, there were 38 million people globally living with HIV. Worldwide, there were 1.7 million new infections and 690,000 AIDS-related deaths. Since 2015, there were 3.5 million additional new HIV infections globally because of not reaching the fast-track targets. And also because of not reaching the fast-track targets, there were 820 additional AIDS-related deaths worldwide. Now, let us examine the situation here in the Caribbean. But first, you may be wondering where these data come from. Country teams use the UNAIDS supporter software to develop estimates every year. They include data on antiretroviral therapy, HIV-related behavior, policies, expenditure, and other indicators measuring progress towards global commitments. treatments. Surveillance among pregnant women attending antenatal care clinics and national representative population-based surveys are used to develop modeled estimates of new infections, people living with HIV/AIDS-related deaths. The data that UNAIDS publishes are produced by countries themselves and submitted at the end of March. UNAIDS supports 16 Caribbean countries in this process. There were estimated 330,000 people living with HIV in the region at the end of 2019. Overall, Caribbean adult HIV prevalence stands at 1.1%. In 2019, about 3 of every 4 people living with HIV in the Caribbean were aware of their status. That's 77%. This compares to the worldwide average of 81%. 81% of diagnosed Caribbean people were on treatment last year, around the same level as the global average. But while 80% of Caribbean people on ARVs were viral suppressed, the average worldwide was significantly higher at 88%. Progress across the testing and treatment cascade has slowed down. This means we need to expand proven methods of active case finding, linkage to care, and retention in care, including through community-based programs. To reach 1990 targets, the Caribbean will need to get 42,000 more people diagnosed, 61,000 on treatment, and 75,000 viral suppressed by the end of this year. This may not happen. But one hopeful finding from the report is that the Caribbean countries have what it takes to scale up HIV services and reach ambitious goals. Such countries have achieved some countries have achieved elements of the 1990 targets, while a couple others are just shy of the target. Barbados has reached the target for testing, while Guyana has exceeded it with 94% of people living with HIV diagnosed. Cuba is just shy of reaching the treatment targets, while Haiti has gotten an amazing 98% of diagnosed people on treatment. While Barbados has almost reached the third target, Suriname, Trinidad, and Tobago have achieved viral suppression among at least 90% of people living with HIV who are on treatment. Even as we recognize these successes, we must remind ourselves that unless the testing targets has been achieved, all other outcomes are suboptimal. But this shows that within our region, we have the capacity to deploy the people, policies, and programs to end AIDS. Last year, there were 6,900 AIDS-related deaths in the region. Deaths due to AIDS decreased by 37% since 2010. Behind Eastern and Southern Africa, this is the world's steepest rate of decline in AIDS-related mortality. As the graph shows, mortality reduced more quickly among females than males. And this is the reason why total antiretroviral treatment coverage for the region was 63%, which breaks down to 71% for women, and as opposed to 56. As opposed to just 56% for men. Throughout the world, women are more likely to access treatment, but the gulf is larger in the region than in most others. In the Caribbean, viral suppression among women living with HIV is 13% points higher than among their male peers. Year after year, the data tells the story of men's inadequate access to HIV services. It is time for a comprehensive strategy to meet men where they are, increase demand, and adapt service deliverable to their needs. New HIV infections decreased 29% for the region as a whole since 2010. This represents just 25% decline among males, but a reduction by around 1/3 for females. Altogether, 1/3 of new HIV infections in the Caribbean in 2019 were among young people aged 15 to 24. 16% were females and 14% were male, and 3% were transgender. 2 of every 5 new infections were among men between the ages of 25 and 49. Altogether, males ages 15 to 49 accounted for 57% of new infections. Once again, the message is loud and clear. Prevention and education and interventions are not reaching enough of our men. Here we see 60% of new infections in the region were among members of key population communities and their sexual partners in 2019. This includes 26% among men who have sex with men, 6% among sex workers, 5% among transgender people, and 3% among people who use drugs. This disproportionate vulnerability of key and vulnerable communities is one of the major barriers to ending AIDS in the region. Sorry. Great strides continue to be made in the Caribbean towards the elimination of mother-to-child transmission, with 7 countries and territories achieving the WHO PAHO revalidation process. Vertical HIV transmission reduced by nearly half since 2019. As this graph shows, 86% of pregnant women living with HIV received antiretroviral therapy to prevent transmission to their babies in 2019. The most recent data from population-based surveys showed that while discriminatory attitudes towards people living with HIV are declining consistently, in some countries like Belize and Guyana, they are rebounding in others. They are rebounding in others like Haiti. In the case of Belize and Guyana, the prevalence is reducing. But even where the situation is improving, ignorance and prejudice remains high. We have to engage people consistently around ending discrimination. We must also improve accountability and redress mechanisms when people's rights are violated. The 2020 Global AIDS Update notes that even before COVID-19, Caribbean states' health systems were struggling to cover programs traditionally funded by international donors, including HIV prevention and key population-focused initiatives. Between 2010 and 2019, there was 30% decline in disbursements by Global Fund and 19% decline in investments by the United States government. HIV resources availability from domestic sources increased by 38%, which is good, from 2010 to 2019. It is critical that Caribbean governments guard these investments, even during COVID-19. We must remember why they were made in the first place. As things stand, HIV response resources for the region are just 42% of the 2020 targets. The impact of COVID on the Caribbean responses. COVID has seriously impacted the AIDS response. Even before COVID, we were not on track to meet the 2020 targets. Now COVID-19 increases. The crisis may slow and blow us off the course. The report urges us to leverage HIV leadership and lessons against this new pandemic threat. There are several avenues for this. The crisis is an opportunity to adopt multi-monthly dispensing of HIV infections for stable patients in accordance with PAHO WHO guidelines. The graph shows that most reporting Caribbean countries dispense treatment on a monthly basis. Adopting the multi-month dispensing would reduce the time spent in clinics both during and after COVID. The report notes that communities are stepping forward to lead local COVID-19 responses. They are challenging misinformation and stigmatization, delivering essential supplies to the vulnerable, and organizing local support systems. By empowering and partnering with communities, responses can achieve a reach, impact, and equity that government facilities could never realize on their own. It is imperative that community organizations are resourced at this time. Their work is key to ensuring HIV program gains are not lost. The situation of women and girls. Finally, this year, the global community marks 25th anniversary of the 4th World Conference on Women and the adoption of the Beijing Declaration and Platform for Action, the 25th anniversary. Gender inequality and harmful gender norms continue to restrict women's control in deciding how, when, and with whom they have sex. It also limits their ability to lead lives that are free from violence. As we have now heard many times, the uptake of HIV testing and treatment services in the Caribbean is significantly higher among women than men, which is good. But too often, women's other concerns remains high or go unaddressed. Gender-based violence is a major challenge. Across the Caribbean, countries with available data, on average, 12% of women aged 15 to 49 years report experiencing physical or sexual violence by an intimate partner in the past 12 months. Thank you very much for listening, and thank you. And remember to access the report and other resources on unaids.org, and all data are on the AIDS info.unaids.org, or you can contact the sub-regional office directly for any of your queries. Thank you.
Thank you so much, Dr. Guwani. And I'm really pleased to invite for our community response a very powerful young female advocate. Her name is Renatta Langlais. She is the Vice Chair of CRN+, and she's also a board member of the Global Network of Young People Living with HIV. So Renatta, I hand over to you. Please feel free to open your mics. Great.
Hello and welcome everybody. I just want to say before I start, we're having very bad weather here in Dominica, so if it just, if it disconnects and reconnects, that's why. Can everybody hear me? Can you hear me, Sergio?
Yes, loud and clear.
All right. Good morning and welcome everybody. Thank you so much for the opportunity of being here to share and contribute a civil society perspective on the presentation. My name is Renatta. I am from Dominica. I'm presently Vice Chair of CRN+. So the Caribbean Regional Network of Persons Living with HIV and AIDS is a regional umbrella organization with a mandate for advocating on and behalf of PLHIVs. As a full and equal partner in the collaborative fight against HIV, we are striving to make a meaningful difference to the lives of persons living with HIV here in the Caribbean. Through partnerships, CRN+ continues to work on delivering on its primary roles of advocacy and capacity building for and on behalf of the community. As I review the Caribbean Global AIDS updates, I will acknowledge that the Caribbean has done very well with our current depleting funds. We continue to work collaboratively on decreasing the HIV prevalence, as we saw in the report, from 6% to 3.9% over the past 9 years, and continue to strive to ensure that we keep our we keep the elimination of the mother-to-child transmission suppressed, or just not in it at all. So as I mentioned earlier, with depleting resources to address HIV and AIDS in the Caribbean, CRN+, among other CSOs, are tasked with doing the same or more with less funding, and now with the present COVID pandemic. As COVID-19 increasingly affects all our countries and communities, CSOs have increased collaborations with national and regional partners to continue our work to continue to work together, to understand the challenges and advocate for our beneficiaries across the Caribbean. PL-HIV youths and young people from other marginalized groups have also had to address the present COVID situation and its challenges and the effects it has on young people. For those of you who may have known about our recent PANCAP Youth Town Hall meeting, which happened on the 11th of June, that gave young people an opportunity to voice their concerns and opinions on COVID-19 and HIV. So I just want to say a special thanks to PANCAP and our PANCAP Youth Advocacy Steering Committee. So we see that the work of civil societies in the Caribbean is very important. Gaps such as continuous and strategic data collection to not only provide a wider picture, but to ensure that governments not only invest in, but also forge collaboration with civil societies to effectively enhance our data collection measures in order to achieve a more accurate presentation of the Caribbean region as we continue to fight against HIV and AIDS. So as we continue to strive for even more improvement in HIV in the Caribbean, I would like to offer the following observation which I saw and we discussed from the Global AIDS updates. So firstly, we saw that under the antenatal care, there were challenges in pregnant women accessing antenatal care. And these pregnant women included those who were migrants from the migrant population, victims of gender-based violence, and those living in poverty. So we are saying that these are some of the areas that we as CSOs can play a more important role to ensure that these services can be accessible and we can reach these marginalized groups. The report which we saw also highlights that there was a huge disparity between territories regarding the provision of PrEP. And as Dr. Guwani, I hope I'm pronouncing it properly, explained, Bahamas, Barbados, Dominican Republic, Jamaica, and Suriname, they're doing a very good job in reducing their prevalence rate. I think some of it contributing, or some of the results are from their provision of PrEP in their countries. We saw that Bahamas and Barbados are providing that services through their national health system. In Dominican Republic, NGOs are providing it, and Jamaica and Suriname are providing it privately. So my question to us is that, how can we work together to ensure that PrEP is available and advertised in the smaller island nations in the region? We know that small island nations, there's some small island nations do have that service, but I don't think many people are aware of it, or it's not advertised as much. In the statistics, there was also a focus on the transgender population. We saw that transgender women HIV prevalence rate were at a higher rate than those of sex worker women. So that was a very interesting piece of data, and it provoked us to consider ways and means of how CSOs can be more inclusive in collaboration with governments in addressing the needs and the challenges of the transgender population. For our migrant group, again, we saw that it was even more, it is becoming more, it is difficult to move around within the region and to keep up with the adherence protocols. And as we all know that within the Caribbean region, we are practicing one single market economy. However, there are still countries who are still sovereign and still operate differently towards non-nationals. So as a result, ARV medication is not free in some countries. So we as civil societies, we are saying, and we are trying to advocate as to how, now that we are tasked as to how do we advocate, on the behalf of migrant population for the services to be free and the information to be available in different languages. We in Dominica, we have a lot of Haitian population now, so we need different languages to be able to reach them. Stigma and discrimination, as I also saw in the report. In the past, it has been a great challenge to persons living with HIV and AIDS. And many women become victims to intimate partner violence, especially those living in poor family situations. However, it was very good to see that in Haiti, it shows that there was a decline in the percentage of GBV from 2000 to 2016. So we are asking that what are the protection measures put in place to help to eliminate the violence against women? We know that governments tend to create and amend policies and laws. For example, the one in Dominica, which was done in 2016, our Sexual Offense Amendment Act. However, the implementation is usually dragged along whilst women and children continue to suffer and HIV spreads. It can be argued that this could be a lack of political will and that there is a majority heterosexual male cabinet within the region. However, we as civil societies need to work together and lobby to try to push to change these policies and laws and allow it to go so far as to be implemented to help eliminate violence against women and girls. And in closing, I would like to say that the Caribbean, we can end HIV and AIDS, but we must remain ever vigilant if we are to close the gaps. Comprehensive and consistent efforts are required to keep reaching the HIV and AIDS population and eliminating healthcare discrimination within the Caribbean. CRN Plus and our civil society colleagues are grateful for the data. I think it's a very good report. To draw on it, from it, campaign material or campaign themes, and to inform our policy planning as we seek to promote the opportunity to ensure that PLHIV, people living with HIV in the Caribbean, live full and productive lives. And finally, we'd like to pay tribute to the many nurses and doctors and other healthcare staff, including our CSOs, who continue to work during the COVID period, those who were on the front line, those who were essential workers. And our collaborative mission is to ensure that none of our peers, our people we work with, our partners, are left behind. Thank you.
Thank you so much, Ms. Langlais. I mean, we really appreciate that from the start and at the end, you've emphasized the importance of us getting it right with respect to communities and COVID-19. They have to be involved. They are as instrumental in ensuring that HIV treatment and care continue, as are the healthcare workers. And so this is something that, as a partnership, as an HIV response, we need to focus on going forward. I'm now going to invite Mrs. Kim Simplis Barrow, who is the chair of SCLAN, and she's also the special envoy for women and children in Belize. And she is going to respond to the report, and in particular, its messages on women and girls. Mrs. Simplis Barrow, I hand over to you.
Thank you so very much. Good morning, distinguished guests, ladies and gentlemen. I bring warm greetings from the government and people of Belize, and I really hope that you are all staying safe and in good health during these unprecedented times. I would like to thank UNAIDS for inviting me to give the featured remarks. In my capacity as chair of the Spouses of CARICOM Leaders Action Network, SCLAN, and as Belize's Special Envoy for Women and Children. I believe events such as this one provides the ideal opportunity to underscore the importance of concerted effort for the health, safety, and well-being of our women and girls. As the ongoing pandemic has taught us, mere country-level responses are not enough to address the scale and complexity of global public health issues. On behalf of the First Ladies of CARICOM's sister states, I am pleased to say that much has been done within the Caribbean region to ensure women and girls are given the opportunity to reach their fullest potential. But undoubtedly, there is still so much more that we can do, particularly in this time when people are sick, scared, and the very fabric of society is at risk. These are times that demand organized, decisive, and innovative policy action. We must recognize that the poorest and most vulnerable, primarily women and girls, will be the hardest hit. If words alone are insufficient to convince that we must act with much coordination and urgency, the most basic statistics on the issues under consideration may help to paint a more vivid picture. Around the world, women are discriminated against and continue to have insufficient access to high-quality sexual and reproductive health information, education, and services, including family planning, all of which are central to realizing and protecting their sexual and reproductive rights and reducing HIV risk. As such, HIV/AIDS remains the leading cause of death among women. Non-communicable diseases, the second leading cause. Additionally, women and girls are increasingly susceptible to higher risk of HIV infection linked to economic, social, political inequalities. Global data indicates that women and girls make up more than half of the 36.7 million people living with HIV. In the Caribbean, 1/3 of new HIV infections in 2019 were among young people. According to the World Health Organization, adolescent pregnancies are a global concern, with approximately 16 million girls aged 15 to 19 years and 2.5 million girls under 16 giving birth each year. It is also no secret that Latin America and the Caribbean has the second highest adolescent fertility rate in the world. The ongoing COVID-19 pandemic has likewise demonstrated the adverse impact a global health crisis can have on HIV prevention, testing, and treatment services. During this time, women and girls are exposed to higher risk of contracting HIV due to the extended confinement measures, economic and social stresses, and the overloaded healthcare systems. These pressures, along with gender inequality, underpinned by harmful gender norms and unequal relationship dynamics, can increase unprotected sex and sexual violence, in addition to limiting access to key essential services, which undermine women and girls' agencies, their ability to prevent unwanted pregnancy, and in some cases, the transmission of HIV. A recent UNAIDS study also revealed that COVID-19 will have a significant effect on access to antiretroviral therapy supplies worldwide. Cognizant of these realities, we must ensure that the global COVID-19 response to HIV prevention and care is grounded in safeguarding the dignity, agency, and the basic human rights of individuals for more equitable access and successful HIV responses. In leaving no one behind, we must continue focusing on putting women's and girls' needs at the forefront so the progress we have made is not undermined. Today, as we launch the global UNAIDS monitoring report, let us acknowledge the strides we have made while not ignoring the many areas for improvement in response to the HIV epidemic. Allow me to take stock of a few regional accomplishments and gaps. I begin with mother-to-child transmission, which has decreased by nearly 50% since 2010. Additionally, a total of 7 countries have eliminated mother-to-child transmission. Still, there is a need for improved access to prenatal care and continued treatment of women living with HIV, especially those in poverty, survivors of gender-based violence, and migrants. Health facilities in one-third of reporting countries in the region have been able to integrate HIV treatment and care with sexual and reproductive health, but this needs to become widespread. Through SCLAN, Gilead Sciences funded a pilot project in Belize and Guyana that targets young people to live healthier lifestyles entitled Transforming Lives Through Innovation, implementation of high-impact prevention programs for adolescents, young women and men, with the goals to 1, incorporate newly acquired decision-making and negotiation skills to complement knowledge of HIV/AIDS prevention and protection against sexual and domestic violence. 2, lower their risk for HIV and other opportunistic infections through safer sexual practices. And 3, envision a productive and healthy future for themselves and families with reduced HIV and other STI infections by 2020. Under this project, consultations were held with various groups, including community health workers and young people, to discuss strategies for connecting our youths and vulnerable populations to address services. Working with our youth is particularly important because no decision about young people can be made without young people, and no programs targeting young people can be implemented without their participation. This in mind, focus group sessions with adolescents and young adults have been conducted to discuss primary health issues and other social concerns that affect their population group, to remove the barriers they may face when accessing services. Ladies and gentlemen, as the chair of SCLAN and Belize's Special Envoy for Women and Children, I stand firm in my position when I say that sexual and reproductive health of women and girls must be seen as a public good. Interconnections between the well-being of women and their children and every other human rights-based development indicator are well known and documented. I say this to emphasize that the investment we make in sexual and reproductive health will yield enormous returns for women, their families, and societies in general. In closing, I urge you to view the report as a guide that will influence how we traverse the effects of COVID-19 pandemic on HIV prevention and care services. In the words of UN Secretary General Antonio Guterres, the creativity of our response must match the unique nature of the crisis, and the magnitude of the response must match its scale. We must take strategies that have worked and modify them to fit the current times, as the normal rules may no longer apply. I thank you for your presence, and I hope that we will all pledge to take collaborative action and demonstrate a greater commitment to the continued adaptation and implementation of the global strategy for the benefit of all women, children, and adolescents. I thank you.
Thank you so much, Mrs. Simplis Barrow, for that very passionate entreaty for us to do the work that we have committed to do with respect to sexual and reproductive health, but also to be on high alert for how this all translates and plays out in the context of COVID-19. We appreciate it so much. We are now going to move on to Dr. Joy St. John, Executive Director of CARPHA, the Caribbean Public Health Agency, and former CMO of Barbados. Dr. St. John is going to analyze in greater depth how we move forward in terms of both the HIV and COVID-19 responses.
Thank you very much. It is a privilege to speak at the launch of the 2020 Global AIDS Monitoring Report to discuss the parallels between COVID-19 and HIV and AIDS. 2020 has taken a path that none of us expected. We literally saw the earth pause as we came to realize that COVID-19 is in every activity that feeds our souls. At the start of the AIDS epidemic, society stigmatized one country in the Caribbean, as China has been stigmatized. But as spread was faster, the level of stigma and discrimination, which made PANCAP produce model legislation, thankfully has lessened. Public health professionals must address these reactions, which are fueled by fear and misunderstanding. CARPHA has tried to guide risk communications to tell the story of how to live with COVID-19 and be kind to persons affected by this pandemic. We saw the rise of misinformation and fake news to exponential levels for COVID-19, which is reminiscent of the early days of HIV and AIDS. Earlier this year, fake news was spreading faster than COVID-19 in CARICOM. This has waned because the public is relying on trusted sources. What is happening now is an overload of scientific information. This infodemic is a function of an intensely scientific approach to the understanding of COVID-19, akin to the HIV/AIDS scenario. In response, the Caribbean Network of Research Ethics Committees has resumed efforts to ensure an ethical approach to the growing CARICOM research agenda. CARPHA participates in the regional level UWI steering committee for the CARICOM arm of the WHO Solidarity Clinical Trial. An expert advisory group of member state professionals was convened to enhance the Caribbean focus in the guidance on clinical management of COVID-19. PAHO's representatives infused the global perspectives. The efforts to produce a vaccine and an approved course of treatment have been swift and flexible, akin to HIV/AIDS. At first, with HIV, there were expensive prices quoted for treatments, but the scale of restriction of access to COVID-19 treatments is unprecedented. The CARPHA Medicines Quality Control and Surveillance Department has implemented a risk-based post-market surveillance program to ensure the quality, safety, and efficacy of medicines in the Caribbean market and detect substandard or falsified products. This program supports and strengthens national and regional medicines regulatory systems. As early as February, MQCSD monitored and shared an advisory with its focal points in the National Medicines Regulatory Authorities, CRS, and the expanded Technical Committee for Pharmaceutical Policy. They have not reported any supply chain issues regarding procurements of ARVs or medications associated with the treatment of HIV/AIDS in this COVID-19 environment. This, however, is in stark contrast to the persistent procurement issues with equipment and supplies for COVID-19. Concerted efforts are required to address affordable pricing and to ensure global access to COVID-19 vaccines and medications. Programmatic changes for stable HIV and NCD patients included extended prescriptions, as Dr. Guwani told us earlier. And patients were visited by HIV programs if they could not access public sector facilities. There is anecdotal evidence of crises being precipitated in the NCD patients who obeyed the order not to circulate and changed their health-seeking behavior. In Barbados, the food bank also saw a decrease in visits to collect food packages, precipitating appeals. Health authorities must avoid crises in these two vulnerable populations. Continuous monitoring and re-evaluation of considerations for vulnerable populations at risk from COVID-19 are critical, as the demographics for COVID-19 are quickly changing. HIV programming is supported by laboratory testing, as management is evidence-based. Over the years, the CARICOM region has transitioned from limited HIV laboratory capacity to the capacity being resident within member states. CARPHA's medical microbiology laboratory initially provided support to member states for COVID-19 PCR testing until they received capacity. CARPHA, with support from the regional security system, continues to test since commercial flights have been halted. To date, our lab has tested 8,296 samples for COVID-19 and counting. HIV/AIDS was first detected in 1970, and the first commercial blood test was not licensed until 1984. Mere weeks after the COVID-19 outbreak was reported, PCR testing was developed. Evidence-based clinical management is important in COVID-19 management. Just as accurate rapid HIV tests exist, the world needs accurate, accessible rapid tests for COVID-19. Voluntary testing exists and is now available for HIV with specific access mechanisms. Similarly with COVID-19, people are encouraged to get tested if they present signs and symptoms. It is becoming necessary to allow testing of asymptomatic persons to achieve a safe return to economic activity. The measures which allowed affordable, reliable testing for HIV are worthy of application in the new normal of life with COVID-19. The HIV response in CARICOM has been characterized by political will. At the start of the global COVID-19 emergency, the CARICOM region relied on the strong public health leadership of the chief medical officers and the ministers of health. The results were a global best practice from my perspective, because the region responded to what was happening with unity of thought, purpose, and action in well-choreographed functional cooperation. The CARICOM heads of government exercised tremendous leadership in the response to this COVID-19 pandemic, both at the individual national level and the collective CARICOM regional level, where they focus on an all-of-society approach. At the regional level, the Conference of Heads led by the then chair, the Honorable Mia Motley, mandated a common public health protocol for the region. The CARICOM heads were effective in building trust in the community as part of the strategy to fight COVID-19, and the public responded accordingly. I witnessed what I call a social experiment. Masks were judged to be useful, then a fashion statement, and now are commonly used. WHO later recommended cloth face coverings. The Caribbean Regional Strategic Framework is a manifestation of multi-sectoral action towards the goal of elimination of HIV/AIDS. Within this framework, it acknowledges that successes rest on the joint efforts of regional public health agencies, donor partners, civil society, and private sector agencies. To respond to COVID-19, CARPHA employs a strategy of collaboration with key regional and international partners and experts for a coordinated approach. From the Regional Coordination Mechanism for Health Security, which reviews the framework for public health action, to the CARICOM COVID-19 Tourism Task Force, which brought public health and tourism sector solutions to the COVID-19 crisis, to the EU, IDB, AFD, and other partners who supported CARPHA's resource mobilization, all have been critical to achieving a targeted and impactful response. The pandemic has been described as a marathon being run at sprint speed. CARICOM has responded to move swiftly to save lives while preserving the best of our cultural and societal peculiarities. In so doing, we showed the world that despite our small size and under-resourced health systems, we could survive unrelenting adversity. COVID-19 still rages and may reverse the gains of the past. What HIV/AIDS parallels can guide mitigating actions? The gains in the response to HIV/AIDS were made by actions which were guided by evidence. I challenge the authorities at the national level to examine their data sharing policies to ensure that they make regional data sharing a priority to facilitate analysis to inform decisions at the CARICOM regional level. In closing, I commend UNAIDS for this impactful launch and applaud national and regional governance, political will, and the determination of our citizens in achieving a tremendous feat through the focus on the value of our collective lives. I thank you.
Thank you so very much, Dr. St. John. And you know, the critical message I think for us is to remember that we are small, but we are mighty. We are able to do this. We are able to respond to both diseases. I invite everyone to participate in about 10 minutes and answers. Again, there's a little chat icon that's next to the hand icon. If you'd like to ask a question, please type it in there and I will pitch it to our panel. And if you are from a media organization, please, when you send your question, also indicate which media house you are representing. First question to Dr. Guwani. What must the Caribbean do? What's the key message about what we must do to accelerate progress at this time? We're behind on testing, we're behind on viral suppression. What are the critical things that national AIDS programs need to do differently and get right?
Yes, thank you. I don't know whether you want to ask a number of questions or just one. So I think we need to do three things: increase testing. Once we get those who need treatment, put them on treatments, and then follow up with viral load testing to make sure that people are virally suppressed. These are the very simple steps. However, there are bigger layers. I think the National AIDS Program directors are working extremely hard at ensuring that these three principles are ensured. But I think we also need to reach out to people, especially in the Caribbean, where we've seen lack low access to services for men. Let's reach men, let's identify where they are, let's go for them, let's domesticate testing services at the community level. The communities know where people are. So engaging communities, engaging civil society, working collaboratively with all players to increase testing. Once we identify people, put them on treatment, and then do the viral load test. So this is the three simplistic approaches. And again, I think time is not time. We don't have enough time to divulge into each of these three, but that's my short response.
Thank you. And a question for Renatta Langlais. Could you explain from the perspective of community what the challenge is around stigma and discrimination? Because we have testing services available, we have treatment services available. What is the barrier that is blocking us from achieving the results that we should achieve? Do we have Renatta online still?
Well, for some people, and I can say in some countries it has been lessened over the years, but there's still, now we find that the stigma is attached to the building itself. So if you go there, people associate you with that building and they assume that the person is positive, because though we've had lots of campaigns about HIV and how it is transmitted and so on, there are still people who don't know the information and still discriminate others. So we are seeing now that sometimes the stigma is attached to the building where the persons go for the to access care. So that sort of restricts them from doing it, and stigma too. And we've also has made some headway in, how should I say, disseminating where, so the medication or the care would not be accessed in just one central point. We have, some Caribbean islands have tried to disseminate it so people source their medication in places closer to themselves, and some people are still choosing not to because the community that they live in, there's some fear that if they go in that particular place to receive, everybody would know. I've had situations where, well, I've known of a situation where one particular person who is HIV positive, she's a nurse, and the person who was going to take her bloods wasn't very professional at all when she knew, or when she learned, when she saw whatever was marked on her file. The person was actually trembling to actually draw the blood, and then something came up, and instead of finishing attend to her and then go to the next thing, she just left the girl with the blood dripping from her hand. So I don't know, there is a lot of work needs to be done with our healthcare workers, sadly, because they're the ones that should know better and should be able to share the information, or for other people in the community to know better. But some of our healthcare personnel are not professional at all, and I think they help to perpetuate the fear and stigma and discrimination in some countries.
Thank you, Ms. Langlais. So, you know, again,
go ahead.
Thank you. Again, a reiteration that we need to revisit the issue of healthcare discrimination. It's something that the region has done a lot of work on. We've had a lot of success with it, but it has to be reinforced, just as the general population anti-discrimination messages have to be reinforced. A question to Dr. St. John about stigma and discrimination as it relates to COVID-19. What are the strategies that need to be employed to address some of the prejudice, some of the vitriol being directed to families and to individuals who have been coping with COVID-19? And are there any lessons from the HIV response that would help us in this respect?
I think one of the biggest things that will help is this whole demystification of COVID-19 and precisely what it means if you have had it. And this was one of the big drives with HIV in the early days. Another thing may not be under the control of the persons who work in HIV programming, but unfortunately, COVID-19 has become increasingly politicized. And it is very difficult in circumstances where you have a pandemic such as this, and many world leaders have either used COVID-19 or countries where COVID-19 have come from for politicization. It tends to have legs, and it influences others to also react in a negative way. But the risk communication, letting people understand about COVID-19, making them realize that everyone is vulnerable and some more than others, and teaching them empathy is important. There are a lot of mental health issues connected with this pandemic, and some of these issues manifest themselves in this extreme behavior and misbehavior that we have been seeing across the world. And perhaps, and this is something that several of the health agencies are working on, perhaps we need to address the fact that some of this is due to mental ill health.
Thank you so much, Dr. St. John. There is a question for Mrs. Kim Simplis Barrow about using the female condom not only as a dual protection method, but also as an empowering tool that facilitates safer sex negotiation. Mrs. Simplis Barrow, does SCLAN have a position on use of the female condom and any other strategies that we could use to empower women to have safer sex?
Good question, actually. I think it is important that we empower our women to make decisions for themselves, and therefore I strongly believe that women should have available female condoms because it puts the power to make that decision in their hands, and that's what we want. And so yes, we actually work on whenever we engage with our women, especially women in rural areas and in these communities, we try to educate them on all their options, and making reference to the female condom is so very important because, like I said before, it is really having them take charge of their bodies and making the decision of whether or not they will use it. So we continue to educate and to promote the use of condoms, definitely, female condoms especially.
Thank you so much,
and this gives me an opportunity to say something, because it really goes to reinforcing my point on doing things differently. Stubborn and persistent problems have stubborn and persistent roots that keep them striving. We are seeing that the disparities in COVID-19 is showing us that those who had poor access to health and social services to begin with have been the hardest hit and overrepresented among severe cases and mortality. We're also seeing it as the globe witnesses the global outcry on racial discrimination, as a people of color around the world declare enough, and a call for different and meaningful systematic change. We're seeing that at an amazing level worldwide. And we need to see the same in gender equality and the systematic protection and respect for our rights and the human rights of women. Leaders, policies, communities, everywhere need to urgently examine where their actions are failing short and change systems in order to make the true and enduring impact. So really wanted to emphasize my point about looking at this in a way that we have to make the changes, we have to make the adjustments that we need to really address HIV, gender inequality, and this COVID-19 situation.
Thank you so much, Ms. Simplis Barrow. There are some questions in the chat box about national results, and I would just urge all of you to visit AIDSinfo, that's AIDSinfo.unaids.org, where you can receive graphs, data, search by country, search by region, and you can also go to UNAIDS.org to get the full report if you want to get specific information about your country or a particular issue. At this point, I would like to welcome Dr. Rosmond Adams, PANCAP Director, to give us some closing remarks. And we want to really focus on where we go from here as a region in the context of what the AIDS response has achieved, the gaps we have left to cover, and the new challenge of COVID-19. Dr. Adams, over to you.
Good morning, and thank you very much. It gives me great pleasure to give these brief remarks in terms of the wrap-up and the next steps on behalf of the Pan-Caribbean Partnership Against HIV and AIDS, PANCAP, at this virtual launch of the UNAIDS Global AIDS Update 2020. As we have all been hearing, there have been much talk about COVID-19, and as COVID-19 rapidly spread, the global HIV community is increasingly concerned about the potential impact of COVID-19 on the 37.9 million people living with HIV globally. The Caribbean region is aware of the potential threat that COVID-19 will have on advancing progress towards ending AIDS in the region. This report comes at an important time when we're faced with so many uncertainties in this very vulnerable corner of the globe, if I may put it that way. In addition to COVID-19, the region is faced by slow economic growth, which will present a challenge for financing and sustaining a national and regional HIV/AIDS response. Additionally, other health sector challenges, such as the rising burden of non-communicable diseases, the impact of climate change on health, and the ever-looming threat from natural disasters are just a few examples. The theme for this year's report is Seizing the Moment, Tackling Entrenched Inequalities to End Epidemics. As we continue to maneuver the challenges of COVID-19, this theme is very fitting for us to look at the opportunities that the pandemic has presented and to seize the moment to accelerate action in filling gaps that exist in the regional response to ending the epidemic. While the report highlighted that the Caribbean region has made progress in reducing new HIV infections and AIDS-related deaths, and great strides have been made towards the elimination of mother-to-child HIV transmission, progress across testing and treatment cascade has slowed. Awareness of HIV status is the first step in accessing care, but is also a potential prevention tool and a way to normalize and destigmatize HIV. Therefore, any action on HIV must start with testing and awareness of one's status. And I think that when James answer the question, he mentioned testing as the first pillar in really tackling and addressing the HIV situation in the region. Likewise, we have to focus on interventions that are aimed at improving linkage to and retention in HIV care to achieve the greatest reduction in HIV incidence, especially among key populations, as they are the drivers of the epidemic in the region, accounting for 60% of new infections. It is also important to note that if we are to end AIDS, and even eliminate a number of communicable diseases, especially those that are referenced in SDG 3, we must tackle the entrenched inequalities that stands in the way of progress. The HIV epidemic, as we know, has been unusual in the extent to which discourse about its epidemiology has been linked to poverty and inequalities. And we know that this virus thrives on inequality. Adolescent and young people, particularly girls and young women, must be the focus of any meaningful response, and we've heard this in the discussions today. They are subjected to poor access to healthcare and education, limited empowerment, representation, and opportunities to contribute to decision-making with partners, family members, and communities. Issues such as gender-based violence, harmful cultural norms, stigma, and discrimination put them at increasing risk. Also, addressing the needs of the key population is critically important. Access to care in most of our countries is hindered by several factors, including criminalization of same-sex relationships, hostile communities, homophobic discrimination and violence, external and internal stigma, and limited health education. And all of these must be addressed at all levels, ranging from the political level, the policy level, right down to the community levels. We must also not forget that we must look at our men. And this also came up in the discussions today. There are many cultural and social norms that are proven to be obstacles to prevention and control among Caribbean men. Partially to blame is the macho culture that influences Caribbean men to suppress awareness of their bodies and not to show emotions and vulnerabilities. And this put them at increasing risk and can result in not accessing care, not testing, and also loss to follow-up. We must continue our ongoing efforts to accelerate equitable HIV incidence decline. I also want to touch on the 1990 targets. The region is lagging behind in terms of these targets. According to the report, 77% of people living with HIV know their status. 81% of people who know their status are on treatment, and 80% of people living with HIV on treatment are virally suppressed, with only 50% of all people living with HIV are virally suppressed. These gaps must be filled. We must get these bars rising. There is also another worrying challenge, and Dr. St. John alluded to that. That is the availability of data to guide strategic interventions. Significant data challenge exists in the region, ranging from data quality, the timeliness of data, and the availability of data to guide strategic actions, policy, and planning. We must not look at data only at the macro level, but really support this on the ground. We must go straight down to the granular level and ensure that at the level of all sites that there is also 90-90-90 at all sites, and then be able to put all of this and pull all of this together at the national level and also at the regional level. The issue of supply chain management is one that we have to also tackle. We didn't hear much discussion about this today. However, we have to ensure that there is strategic information to guide supply chain management and that systems are in place to ensure that there is continued access to antiretroviral medication and other commodities. Even so, more importantly now, as we address COVID-19 and the impact that COVID-19 can have on the continuity of care for HIV/AIDS. Ending AIDS and addressing issues such as sexually transmitted infections, STIs, requires a coordinated multi-sectoral regional response as articulated in the Caribbean Regional Strategic Framework, the CRSF 2019-2025. The CRSF is our blueprint towards ending AIDS, and it highlights policies and programs to accelerate progress for achieving the UNAIDS 1990 targets to test, treat, and to defeat AIDS, to which the region has committed to. We also hold strong to our Justice for All program that was launched in 2015 to promote activities consistent with the UN Universal Declaration of Human Rights, to which all countries are committed. The Justice for All program is intended to achieve one of the goals of the United Nations high-level meeting political declaration that was held in 2011 to eliminate stigma and discrimination against people living with HIV by 2015 and to uphold the human rights and dignity for all. And this still holds very valid today, as we've heard in the discussions that the issue of stigma and discrimination still continue to be a significant barrier and an obstacle towards the HIV response, and also we're seeing this with respect to COVID-19. PANCAP will continue to support the regional response by working with national programs, key partners, and civil society organizations, community groups, faith-based organizations, as we address these challenges and work to break down the inequality barriers and other barriers that can retard our move towards ending AIDS in the region. So in closing, I think that we can use this opportunity and to seize the moment that COVID-19 has presented to us to really reignite and call for action for a very strategic and strong response towards the HIV/AIDS response in the region, and to really reignite the actions by all of us, all of the partners, civil society, to come together and to let us address these inequality issues that are serious threat towards ending HIV/AIDS in the region. I thank you very much, and we look forward to working with all of the partners in addressing these issues.
Thank you so much, Dr. Adams. As you reiterated, we have an entire framework that's going to guide our progress. It's so important that we recommit to the targets, to the strategies outlined in the Caribbean Regional Strategic Framework to End AIDS, and also that we make the adjustments necessary to ensure that in the context of COVID, we're getting it right. Communities are at the table, people have their immediate needs addressed, and we ensure that they have ongoing access to all HIV services, including prevention, treatment, and care. On that note, I would like to thank all of our presenters, thank all of our HIV response partners and journalists who have participated in the response today. And I'll close with a final reminder to please go to unaids.org in order to access the report and associated resources, and also aidsinfo.unaids.org for the data. I thank you all. Bye.